Hi, let's talk about the muscles of facial expression. In this video, we'll discuss the various groups of facial muscles, how they're distributed about the face, their functions, and their innervations. So, the superficial muscles of the head are divided into two groups. The epicranial muscles are those muscles which are upon the cranium, and the craniofacial muscles are those muscles of the cranium but associated with the face. The craniofacial muscles can be grouped according to the orifice that they control. So for instance, surrounding the orbit and palpebral fissures are the circumorbital and palpebral muscles. Surrounding the nares and nose are the nasal muscles. And surrounding the oral fissure, so the labia and the buccal or cheek regions are the buccolabial muscles. So let's take this group by group. So the epicranial muscles are more diverse than what will be discussed here, but the major epicranial muscle is the occipitofrontalis muscle. So occipital, frontalis, frontal. So those are the two bones that these muscles are going to attach to. So we can conceptualize the occipitofrontalis muscle as one large muscle with two bellies, a frontal belly and an occipital belly, with a large epicranial aponeurosis between the two. Or we can conceptualize them as two separate muscles, the frontalis and the occipitalis. For the purposes of this video, we'll treat them as the same muscle with different innervations. So when active, the occipitofrontalis muscle is going to elevate the brow. So it gives this look of surprise, perhaps slight condescension, depending on how you want to mix and match this. So the greatest amount of movement and expression here is generated by that frontal belly. That frontal belly is innervated by temporal branches of the facial nerve. And posterior to that frontal belly, we have a very large and robust epicranial aponeurosis, which we can also see here as well. This can be very, very extensive. The occipital belly is usually smaller than the frontal belly, and we can see that here. And typically on cadaveric specimens, it might be very hard to see. It tends to atrophy and go through a process of fibrosis with age. So if you don't see a very well-developed occipital belly of occipitofrontalis, it's not the end of the world. It's probably quite typical. The interesting thing is that that occipital belly is innervated by a different set of branches versus the frontal belly. So that occipital belly is innervated by an occipital branch of the posterior auricular nerve of the facial nerve. So that's that nerve that comes out of the stylomastoid foramen heading back that way. So it's going to innervate the occipital belly. It's also going to innervate the posterior auricular and sometimes even the superior auricular nerve. But oftentimes that is dual innervation between the occipital branch and those temporal branches. Moving on to the craniofacial group, let's start superiorly and work our way down. Orbicularis oculi. So orbicularis oculi, let's break that down. Muscles can be named a variety of ways. Sometimes they're named for their attachments or the regions that they overlie. Sometimes they're named for the direction of their muscle fibers or their fascicles. And in this case, it's a little bit of that and a little bit of regional. So orbicularis means that the muscle fibers are arranged in a circular fashion, like so. And oculi refers to the eye. So this is the muscle with circularly arranged fibers that overlies the eye. And there are three parts to it. There's the orbital part, The orbital part is the largest part of orbicularis oculi. That would be everything between these two circles that I've drawn. That orbital part is what voluntarily and forcefully closes the palpebral fissure. The palpebral part, that would be everything within that almond shape area that I've prescribed, overlies the palpebrae. So that was very well named. And the palpebral part is voluntarily controllable, but typically is under involuntary control. So blinking is a function of the palpebral part. You don't spend most of your day thinking, time to lubricate the eyes. So we have that going for us. There's also a third part of this muscle, which lies deep here in the medial area, by the medial angle of the eye, called the lacrimal part. And this is overlying the lacrimal apparatus so as to squeeze it to create pressure to draw tears across the eye. Now, all parts of this muscle are innervated by both temporal and zygomatic branches of the facial nerve. So one of the landmarks that I use is that lateral canthus. So we'll have temporal branches above and zygomatic branches below. Now, deep to orbicularis oculi and also deep to the frontal belly of occipitofrontalis is a small strip of muscle called the corrugator supercilii. Corrugator supercilii. So this is the superciliary region, and corrugator, to make corrugated, this is a furrower of the brow. So when this muscle contracts, like so, it pulls the brow together. This is an action that people will take involuntarily when they are confronted with a bright light. So this can be paired with squinting. So along with orbicularis oculi, you can contract the corrugator supercilii so as to provide your eyes a little bit more shade. This is also something that sometimes involuntarily gets paired with a disdainful feeling that you might have for an individual. Considering this photograph was taken indoors, obviously this person is acting, but this kind of looks like perhaps the recipient of the gaze is in a little bit of trouble. Corrugator supercilii is innervated by temporal branches of the facial nerve. So everything above there would head that way. Next up, the buccolabial muscles. So we're going to skip over the nasal muscles ever so briefly to turn our attention to those muscles that are associated with the oral fissure. So there are several here, and one of them is going to be in that nasal group, and we'll come back to this one. This is one of my favorite muscles, levator labii superioris aliquinasi. But let's begin with this muscle here, levator labii superioris. Levator labii superioris is just inferior to orbicularis oculi, and it's going to the superior lip or the upper lip. And when levator labii superioris muscles in tandem, so let's say we had both of these firing at the same time, that is going to elevate the upper lip, hence the name. We also have moving lateral zygomaticus minor. Zygomaticus minor is over the zygomatic bone, and there are two of these, and so the smaller of the two gets the name minor. Zygomaticus minor, when it fires, is going to pull the lip superiorly and laterally, so we have kind of an oblique vector there, and it is going to uncover the teeth to about the canine. So there is, let's see, central incisor, lateral incisor, canine. It just barely bears the canine. Sometimes the zygomaticus minor is present, sometimes it's absent, sometimes it can be indistinguishable from zygomaticus major, so those two muscles can go together. Nevertheless, if it's there, wonderful. If it's not the end of the world. Moving laterally, we have the zygomaticus major. Zygomaticus major is overlying the zygoma, or the zygomatic bone, and is larger than the minor. We can see here that both of these muscles are coming down to participate in the modiolus. That's that interdigitation of fibromuscular tissues that is controlling the angle of the mouth. So what we have are a series of muscles that are going to contribute to an ever-widening smile. So levator labii superioris elevates the lip. Zygomaticus minor is going to expose to the canine. Zygomaticus major is going to go beyond the canine, as we can see there. So when used in sequence, we have an ever-widening smile. So how wonderful there. All compliments of what these muscles do to the upper lip and that modiolus. Control the modiolus, and you control the mouth. These three muscles are all innervated by both zygomatic and buccal branches of the facial nerve. So zygomatic and buccal branches of the facial nerve. Deep to these muscles, along with levator labii superioris aliquinasi, is that infraorbital or canine fascial space. The muscle of oral fissure facial expression is going to be orbicularis oris. This is the money muscle in terms of social media photography. So orbicularis, those circularly shaped fibers, oris of the oral fissure, would be this muscle here. So this will be deep to and surrounding, deep to the skin of and surrounding the superior and inferior lips. And when contracted, this purses the lips. So if you think about that full-lipped ducky face that people make when they take selfies, that's compliments of orbicularis oris. And orbicularis oris is innervated by buccal branches. So we've got buccal branches coming across, and marginal mandibular branch of the facial nerve. Next up, the buccinator muscle. The buccinator muscle is the deepest of all of the facial muscles here. So it's originating or attaching to that pterygomandibular raphe. And it comes and it is going to attach to the alveolar surfaces or ridges surrounding both the maxillary and mandibular teeth. So this is really forming the muscular wall of the cheek. When contracted, the buccinator muscle is going to push anything in the oral vestibule deep. So that's going to bring food into the occlusal surfaces or between the occlusal surfaces of maxillary and mandibular teeth for eating, which is a nice thing to do, right? It's helping the muscles of mastication by bringing the items to be masticated between the teeth. The buccinator muscle is interesting in that it is pierced by the parotid duct, and superficial to it we have a very robust and nice buccal fat pad. So we can see that buccal fat pad here in the cadaveric image, and we can see the parotid duct moving across and then diving deep into what would be the buccal fascial space. So that buccal fascial space is traversed by Stenson's duct, or the parotid duct. Coming through this space is the buccal branch of V3. So the maxillary division of the the mandibular division of the trigeminal nerve sends the buccal nerve anteriorly through this space to afferently serve the skin of the cheek and also some of the gingiva surrounding the molars. Very frequently, this buccal nerve is referred to as the long buccal nerve by clinicians. Now, we also have a couple of other muscles controlling the oral fissure. Life can't be all smiles. And so, in this case, we're not done smiling. Deep to the levator labii superioris is so here we have that levator labii superioris, is the levator anguli oris. So here, coming from the modiolus up to the maxilla, deep to levator labii superioris is levator anguli oris. It's an elevator of the angle of the mouth. So it's enabling a smile. This muscle is innervated by buccal branches of the facial nerve, as it should be for that region. We also have a highly variable muscle, the risorius muscle. Risorius muscle may be present, it may not be present. It goes from the modiolus out laterally, superficial to that buccal fascial space. And when it's activated, it pulls the sides of, or the angles of the mouth laterally, so as to produce a smirk. And like levator anguli oris, risorius is also innervated by buccal branches of the facial nerve. Now, some of the frowny muscles. Let's start with depressor anguli oris. Depressor anguli oris is originating from that, or I should say attaching to the modiolus and going down to the mandible there. Depressor depresses the angle of the mouth, so it pulls the angle of the mouth inferolaterally. And this muscle is innervated by both buccal branches of the facial nerve as well as the marginal mandibular branch of the facial nerve. We also have depressor labii inferioris muscle. Depressor labii inferioris muscle tends to be deep to depressor anguli oris. And this muscle, when working in concert with its counterpart, is going to depress the lower lip. So to pull it downwards. We also have the mentalis muscle. The mentalis muscle is in the mental, or the chin region. And when active, the mentalis muscle is going to produce a pout by both elevating and protruding the skin of the chin. So by pulling this chin skin upwards, it displaces the lower lip to produce the pout. And mentalis is innervated much the same way depressor labii inferioris is, by the marginal mandibular branch of facial. Now, the nasal muscles, starting with one of my favorite facial muscles, the levator labii superioris aliqui nasi. So let me trace this muscle for you. This is going to blow your mind. So levator labii superioris, it's going to elevate the superior lip, which it does. And there's also this little slip of muscle that goes to the ala, or the wing of the nose. That's the area above the nostril. So elevates the upper lip and also the wing of the nose. So levator labii superioris aliqui nasi is going to dilate the nostril and elevate the upper lip. So I kind of think of this as kind of like the Elvis snarl, if you're familiar with the King of Pop. And this muscle is the longest named muscle of any human muscle. So if you're ever at a trivia night and you're asked what the longest name of any muscle is in the human body, it's levator labii superioris obliqui nasi, which is innervated by both the zygomatic and buccal branches of the facial nerve. Next up, we have the nasalis muscle. The nasalis, or just the nasal muscle, has two parts to it. Sometimes these parts are given their own muscle name. So we have one part, the transverse part, that is over the body of the nose here. So running along the bridge of the nose, down laterally. Now, when that contracts, it actually constricts the nares. And so that transverse part, when given its own name, is called the compressor nares. There's also another part from the alar region that when it contracts, it pulls the alar region outwards. That's the alar part, also known as dilator nares. So compressor nares and dilator nares are antagonistic to one another. And both are innervated by zygomatic and buccal branches of 7, which makes sense. And this leads us to our assessment question. And that would be, which muscle may both elevate the upper lip and dilate the nares? So elevate the upper lip and dilate the nares. Let's see. Levator anguli oris. That's going to pull the modiolus superolaterally. So that's a smiley muscle. It's not really an elevator of the upper lip, though. So levator labii superioris. That definitely elevates the upper lip, but it doesn't touch the nares. Levator labii superioris obliqui nasi. Yeah, we've got it. Zygomaticus major and minor are both smile muscles, so they're pulling the modiolus superolaterally. They're not the correct answer. So the muscle with the longest name, levator labii superioris obliqui nasi, is the correct answer. Thank you very much for your time.